A lot of Oregonians have questions about how the state's vaccine supply is being distributed and who's in line to get the first doses. Vaccination plans vary from state to state and country to country.
All new at 6, Fox 12's Simon Gutierrez spoke with a public health expert from Oregon State University to talk about how things are going so far.
Chun Wei-Chi is the director of the Center for Global Health at OSU. He's been closely following the pandemic and the world's reaction to it. Most recently, our own state and country's handling of the COVID-19 vaccines.
Looking at the way vaccines so far have been rolled out, in terms of what you've observed from around the world, how are we doing as a country?
The U.S. compared with other countries probably a bit slow, and there are multiple factors at play now. There are certain portion of Americans who are still hesitant or have reservation about the vaccine. And then there's an infrastructure factor. That's my concern.
Right now, the way that we're rolling this out is sort of fractured. There isn't one agency that's in charge of all of the vaccinations. It's being relegated to or delegated to county health systems, hospitals, providers. Do you think that's the right approach, or should this be a more centralized thing that's run by, say, FEMA?
Personally, I recommend we have some kind of national coordinated effort and give CDC more authority to give guidance, to give from vaccination to control measures.
Listening to the director of the Oregon Health Authority, he suggested that at the current rate, or even the rate that the governor wants or higher, which is 12,000 vaccinations per day, it might be not until fall that everyone will be able to obtain a vaccination. Does that sound reasonable to you? Should this be happening faster? Is there a way to make this happen faster?
My opinion is, if we by we meaning the state, treat this as a very important emergency. If we treat this pandemic as a top priority, top emergency, then we should be willing to mobilize more resources to expedite the distribution, the vaccination with more people. Right now, it seems that besides vaccine, we are out of other control measures.
Governor Kate Brown has set a statewide goal of 12,000 vaccinations per week. Now, even if we hit that mark or even go above it, the director of the Oregon Health Authority says it could be 8 months before enough Oregonians are vaccinated to reach some degree of herd immunity. I'm Simon Gutierrez, Fox 12 Oregon.